Hello out there. I think we're live. I am Dr. Chana Davis, a contributing writer at the Nerdy Girl Dear Pandemic co-branded group, I guess at this point. I'm joined by Dr. Ashley Ritter, the Chief Executive Officer of those Nerdy Girls. Ashley is a nurse practitioner and completed a PhD and postdoctoral training in health policy research. She is the Director of Research at New Cortland, a Philadelphia nonprofit that increases access to housing, health, and social services.
Hi, everyone. I'm so excited to be here today. Thanks for having me, Dr. Davis.
So as a reminder, we Nerdy Girls don't take questions cold. This way we can be sure to have the latest and greatest resources and research at our fingertips. So if you have a question, you can submit it to the question box on our website at dearpandemic.org. So as always, we have a lot to cover, so let's just jump right in.
Dear Pandemic question, you can submit it to the question box on our website at dearpandemic.org.
So Ashley, many people, myself included, have noticed that they've been getting sick with non-COVID infections recently. We're just getting over a cold, so I apologize if I'm a little sniffly right now. So the question that keeps coming up is whether our immune systems have been weakened by 2 years of laying low and masking.
Well, that's a great question. And I can tell you that I feel the pain on this one. So April has been a really rough month in my household. I have 3 children, an 8-year-old, a 6-year-old, and a 3-year-old. And since the mask requirements have been lifted, we have had multiple colds. But the onslaught of these viral illnesses is likely related to catching up after decreased exposures for 2 years and not because we have weaker immune systems. And so I sort of think back to the winter of 2019, 2020. And at that point, things weren't much different. Our family got a few colds, often a stomach virus, every year. And the youngest one always got the sickest. I remember a moment in April of 2020. We were in the woods. I took a look at my son, and he was a year old at the time, and he didn't have a runny nose. And my husband said, "Oh, that's what his face looks like when he's not sick," because he had sisters who had been in school, and he was constantly the kid that didn't have the exposure to these previous infections, and so he was the one that was symptomatic and showed and got the viral infections. So the break in the snotty noses and the puke was really welcome, but it didn't make our immune systems any weaker. Our bodies do need to be exposed to lots of different microbes in the environment. The phrase let your kids eat some dirt is really true. So children that interact with nature and lots of different places that are not too clean, there have been studies that show that those children have stronger immune systems. Being exposed to viruses does not make us our immune systems stronger. So having that reaction and making our immune systems fight off viruses can actually exacerbate other underlying illnesses like asthma, or in older people, we often see people come into the hospital with a viral illness that wasn't all that problematic, but it can trigger other illnesses like heart failure or kidney problems because the body is really busy fighting off the virus and the other systems are compensated. So not getting sick is not causing our immune systems to be weaker. We are definitely doing a little bit of catch up right now because we haven't been, exposed to things that were pretty prevalent and common in our environment. And I think a nice example is flu. So flu was really rare in 2021, and we're now seeing a resurgence in flu infections. So you probably, if you haven't had a flu infection in a couple of years, you might feel a little bit sicker when you do get that flu infection because the immunity in your body can wane over time. Again, this is an example that your immune system is not weaker. It's just being presented with something that appears new. And so you're developing symptoms and feeling sick.
I can't remember if it was on Dear Pandemic post or on a different page, but I saw a study about the number of colds that kids get, and it was kind of, if you didn't get them earlier in preschool, you probably catch more later.
Yes, that study did show that. So it looked at children who have gone, when they've had these exposures to common viruses. So just because we were in smaller social circles doesn't mean that these viruses go away. So they looked at children who had been sicker in their earlier years. It looked that when they were then in school age, that they were not getting as many of those colds. And so the moral of the story of that study was, you're going to pick these things up at some time. If you pick them up earlier, you're not likely to pick them up later. And so there's definitely some catching up going on right now, and it's hard. We do not recommend, purposefully exposing yourself to things, or even, thinking that not being sick is going to weaken your immune system. That is not true. Some things you can do to reduce that risk of picking up all those infections at this moment is, don't share eating utensils and drinks. This is really common among younger kids. It's really hard in a household, not to share those things. It shares the germs. Making sure that we're washing our hands, staying up to vaccinations. Vaccinations have prevented a lot of infections from happening, and, things that we don't even have to think about anymore. So make sure you keep up to date on vaccinations. And in crowded indoor places, you might think about putting a mask on, as we do know that it's not just COVID circulating right now.
I hope we'll see more posts on the Dear Pandemic page about other viruses and other infectious agents, because I think now people's minds are open to questions like, what is the incubation period? Can I be contagious before I have symptoms? And we're having this realization, and how do we transfer that knowledge to other things that we're exposed to?
Exactly. I think that, we're nerds at heart. Don't necessarily need to think just about COVID. There's lots of viral illnesses, and there's lots of other health conditions that we plan to talk about on Dear Pandemic by those nerdy girls. So great point. I can't wait to see what comes next.
I'm just going to note that my audio is not good, so I'm going to try something else. So bear with me for a second.
You got it.
This is my official podcast. We're just going to try it, because this seems to be. Is that better?
You're still a bit froggy.
A little closer to the mic. Does that help? No, I must have a frog in my throat today.
I think there's a frog in your mic, but we'll take it.
Is this better or worse?
Similar feedback that we're getting at the end of your sentences.
Oh, I'm so sorry.
Well, Chana, while you work on that, I do see a question in the question box. So why don't I answer the question while we maybe try out
system.
We can test the system. But a question did come into our question box about having COVID in April. Can I carry it now to someone else if I'm in contact with someone who has been exposed? So the short answer is probably not. When you are infectious, around 10 days from the first day of your infection, and so it's unlikely that you will carry that to someone else if you're outside of that 10-day window. If you are in contact with someone else who has been exposed, they've been exposed by somebody else that you're outside that window. And we're still looking at how long immunity lasts in somebody that has been infected, specifically with these Omicron variants. But typically inside a month, you're unlikely to get infected again. So I hope that answers your question. Chana, I have a question from you. You want to try your audio again?
Sure. Am I any better, or is this am I just froggy?
I think it's slightly better than before, so I think we should go with it.
Okay.
So now that many people are testing for COVID at home, how can we get a sense of our community COVID rates?
Oh, that's one of my favorite topics. I used to be a super geeky dashboard checker, and honestly, my practices and those of many others have changed. And I think this question is probably coming from the fact that a lot of people are testing COVID at home now, which is wonderful. But the downfall of that is that it's not being tracked on public health dashboards. Mm-hmm. So one of the metrics that we've relied on heavily in the past, just COVID case counts and how many cases per 7 days, population adjusted, that is not a reliable indicator anymore. And I think that's really important for everyone to know. That's, I'm not obviously not the first person to point this out, but this is a really important message. You cannot rely on case counts anymore, because it's a massive underestimate because most people now are testing at home. Here in BC, where I am, you can't even get PCR. I mean, it's not that people are there's just so limited access to it. So case counts are definitely not a good metric anymore. There are a number of metrics that are, I think the bottom line is that you have to work with several imperfect metrics at this point. So one metric that dashboards offer is the test positivity rate. So that's a measure of what fraction of tests are actually positive. And the higher that number is, the more it indicates that you're under testing. So that's one metric that people used previously, and it's still useful now because it's useful within the context of the population of PCR tested people. So if that number is going up, then that's concerning. So that's one sort of imperfect metric to work with. Another metric to work with is hospitalizations, and I'm sure you've heard a lot, and a lot of people are tracking that metric now. And it's important as a pulse of community rates, but also in terms of crisis of healthcare system, of course. So the problem with that metric, of course, is that it's a lagging indicator. So it's not going to really tell you what's happening right now. But with this metric, just like the test positivity rates, you want to look at the overall trending of that metric when it's the direction it's headed in, because any single data point is not particularly informative without the context, because it's capturing just a smaller piece of the pie. And another metric I want to touch on that is coming up a lot in the news and is kind of intriguing is the wastewater surveillance. That also is interesting and useful, but incomplete. And so you can look at a U.S. map and you can see which regions are kind of hotter than others, and you also want to check how that's changing over time. And so the bottom line is if all of the metrics are pointing in the same direction and heading in the wrong direction, that's when you want to be concerned. But it's very hard to get a good read on absolute numbers at this time. I'm so sorry, I'm hearing that my audio is not good again. So let me just try back to the way it was. Hello? Okay. How's that?
We can hear you, but you sound slightly like a robot. So if it's okay with everyone, I say let's do audible robot, and we'll see how things go. We're sorry, everyone, for the technology issues. It's been a plague of deer pandemic for about a week, and we really want to be here with you, and so I hope you'll bear with us.
There's a different kind of virus plaguing us, right? Okay, I'm gonna do this one because I feel like it was a little better. Okay, so. Microphone, tap, tap, tap. Are we there? The last one I wanted to touch on is just anecdotes. Normally I would steer clear of relying heavily on anecdotes, but when you hear that, your friend down the street had 3 kids in their class, and the other, in another class at your school had 3 kids going down with COVID, that's actually very meaningful. I think. And this is a case where the positives are more meaningful than the negatives. So some people are obviously not going to tell you. You're not going to know who has it and hasn't shared. But when you're hearing a lot of stories of people in your circle that have it, that is a pretty obvious red flag.
Great point.
Yeah. So I've been leaning more on the anecdotes than I have in the past. So since that's a good overview of this question of how do we get a pulse on community rates. And so, Ashley, let's go back over to you with one-way masking. So now that mask mandates have been lifted in many places, a lot of people are left with one-way masking. So what do we know about how effective that is?
So I think the bottom line is one-way masking definitely provides some benefit to the wearer. It's important to consider a few factors. The first is the type of mask that you're wearing, the way that mask fits, and how much you're really keeping it on in that sort of episode. So one-way masking is not better than two-way masking. When all the parties in a room are wearing masks, the risk of sharing infected droplets is lower. But that's just not the case right now in most public places. So mask mandates have been lifted, through air travel, public transportation, schools, and in many major cities, putting, us in a situation where you may be one of the few people in the room wearing a mask. And there's many people that will decide to keep their mask on. It's a necessity for many people who remain at high risk. And a one-way mask will reduce that risk of getting infected. So a well-fitting N95 mask is the best at decreasing risk. And there's a number of studies that have looked at how much risk reduction the wearer gets from an N95 mask, somewhere between 50 and 90%. I'm sure you're thinking, like, that's a giant range. How do I know how much risk reduction I'm getting in an individual situation? And unfortunately, the answer to that is we don't know. But we do know that it's a significant risk reduction. So if you're trying to avoid infection, it is a good idea to put on a mask. That mask is still providing you with some benefit. To get the best results from that mask, we do recommend an N95 or KN95 mask. If you're committed to masking and that is important to you, now is a good time to switch over to those N95 and KN95 masks. My children refuse to keep a KN95 mask on their face. They don't like them, and they fidget with them. And so for them, we've used a filter within a cloth mask. So we're increasing the number of layers in a mask. It fits well on their face, and they generally don't touch those masks. But I understand not everyone can get a KN95. But if you can, and you're committed to masking, that is your best. An N95 or KN95 is really the best bet at this point. The second is that you want your mask to fit well here, around the cheeks, and under the nose. It's really supposed to create a seal. So it might be snug, and that is actually beneficial. If you have gaping on the side, gaping at the nose, or gaping under the chin, it's not really able to provide that filtration. And so find a brand or distributor that works well for you, and keep a stockpile of them. The last thing that is super important is that in settings that are high risk, where you want your mask to be filtering that air that you're breathing in, you have to keep the mask on. And this sounds like super silly, and of course we have to keep the mask on. But if you think about how many times you bring down your mask to take a bite of food, or to put on some chapstick, or to take a drink of water, or my favorite is when people pull their mask down to sneeze, which is not what you're supposed to do. Those activities, they break that seal. And when you break that seal, the opportunity for, infection that's in the air and droplets around you to be inhaled. So if you're going to mask, keep the mask in place in those high risk situations. Step away to outside, or at least move away from big crowds if you do need to pull that mask down for every reason. And I will say, it's hard to be the only person in the room with a mask on. I have been there. And when there's a sea of noses and chins around you, the cues and desire to put your mask on are lower. So what has been helpful for me is when, to make a decision personally and in our family, when we're going to wear masks. So for me, I'm still masking on public transportation. For my children, it's funny that you said when 3 kids in class are out sick. So my kids and we all had a conversation about why masks are important and when we need to have them on. And so when my kids see that there's a lot of children absent from their class, or they know that children in their class have been sick, we all go back to masking. After we've had some of these colds, we've been healthy enough to return back to school, but we've kept masks on for a few days following to make sure we're not sharing any of our germs with the people in school. So decide within your unit or personally when you're going to be wearing masks, and stick to your own rule. And it's really much easier when you've had the chance to make a thoughtful decision, to then reflect on that when you walk into a situation, as opposed to walking into a room, seeing nobody has a mask on, and taking your own mask and putting it back in your pocket. So that has been helpful to sort of encourage us to stick to the things we talked about as a family, and not, take the mask off in situations that might be risky to us. So one-way masking doesn't need to be an all or nothing. You can put them on in highest risk situations. And the more you wear it, the more protection it's going to provide you.
That's a very thorough answer, and thank you.
Chana, I have a question for you now. Many people are using rapid tests at home to monitor their infections, but are finding that they test positive for a surprisingly long time. And I did see a question in the chat on, just how long people can be contagious after an infection. What are the current testing guidelines, and what do we know about the link between rapid antigen tests and contagiousness?
So I'll touch first on the testing guidelines. And right now, you're supposed to test whenever you have symptoms, or I would recommend testing every time you think you have an exposure as well. But then the more tricky part is once you already know you're positive, then what? And right now, the CDC does not have an official text to exit kind of recommendation, but they do advise if you can and you do have access to test with another antigen test on day 5. And if that test is positive, continue isolating for another 5 days. It's kind of a weird policy because it's like, well, if you don't test, then just go out there and expose others, and sort of better to put your hand, sort of recommending putting your head in the sand. But I think if you do have the access, it's a great thing to get a read on how much virus you're carrying on day 5. Sorry, this sound is killing me. I am hearing major echo of myself. So I'm going to have to adjust that see if I can do something else.
We don't hear it on our end.
Apparently, I sounded good to you. One more try. Okay.
How many microphones does Chana have?
Not technical, girls. We are like a biology nerd. How does that sound?
You sound great.
Okay. So that was the rough sense of the testing guidelines. So a lot of places were using a text to exit strategy, but that's never been standard practice in the States, although most infectious disease experts recommend it as a good way to get a read on your infectiousness. So just to get to the question of, how long do you expect to be positive? What does that mean for contagiousness? So there are kind of two sides to this argument because there isn't really a clear answer. So on the one hand, we know that a rapid test or an antigen test only gives you a positive signal if you're carrying a lot of virus. So they're not very sensitive, which means if they light up, there's tons of virus and viral protein in your nose or wherever you swab. So that's an argument to say that if you're ever positive, you should be super cautious. So that's kind of the base case as they see it, and sort of guilty until proven innocent. So we should assume that a rapid test means you're contagious unless we have evidence to say this is not the case. So now the other side of the argument, there actually is some evidence, although it's indirect, that people are rarely contagious as late as day 10. But this is more of an overall statistic, not an individual statistic. So there was a study on Omicron that something like only 2% of cases, the transmission happened after day 5. That's a very low number. And then how do you reconcile that with the fact that maybe 40% of people are still positive at that point? So clearly there's a disconnect in the numbers between how common it is to be rapid positive for a long time and how much transmission we see at that point. Now, the ideal study to really answer this question would take people who are rapid positive and went back to work and went back to their homes and see how much transmission happened in those rapid positive people and compare them to rapid and negative people. But that study has not been done. So we're left kind of piecing together the answer with indirect evidence that's more of like a holistic view of, well, we don't see a lot of late transmission. We see very rare late transmission, and yet we see a lot of test positivity, even in healthy adults who are having no symptoms anymore. So that's the other side of the argument, saying, well, the risk can't be that high because we very rarely see transmission. And this is why in contexts like there was a study in the UK looking at healthcare workers, they were using the text to exit strategy. So you could only go back to work if you're rapid negative, but after day 10, all bets are off. They sent everyone back after day 10. And the rationale was that overall, we see so little transmission, and that the lack of transmission or the transmission risk comes from the contact tracing study that I mentioned, but also from some of these viral culture studies. So that's another what you call a proxy for contagiousness. They take a specimen from the nose or whatever, and then they try to grow virus in the lab. And basically, in a number of studies have shown, you can almost never grow live viable virus from someone after day 9 or 10. So this is, again, indirect evidence that the transmission risk seems really low overall. So it's really, I mean, there's no black and white answer. It's sort of a probabilistic thing where if you're still positive on day 10, your chance of being contagious are higher than someone who's negative. But we don't know if it's low or really, really low, or 0 is a really hard number to ever give. But you need to consider so many different factors, including how strong is the line, how are you feeling, are you completely symptom free? And then the biggest consideration, I think, is how what risk are you exposing to others? So how vulnerable are those that you are exposing? So it's okay to take a tiny risk in some contexts, but even a tiny risk is not okay if you're exposing someone who's super vulnerable.
Thank you so much for that answer. And it looks like we're getting close to time, but I did want to say that, Chana's response to the first question about, case counts where while we're primarily using rapid tests is available. There's content about that on our website. So if you missed some of the audio there, it's on our website, and we'll try to revisit that again in future lives. But it's been a pleasure talking with everyone today. I look forward to future lives. We do take note of the questions in the chat. So I see some questions about reinfection from Omicron and some discussion about, the difference between policies in different places. So thank you so much for joining and for the questions. And Chana, anything else from you today?
No, I feel like I'm just so apologize for the bad audio and say we'll definitely get this ironed out for the next time. And
absolutely.
Thank you for joining us.
It was great to be here. Thanks for having me.
Take care.